5 proven steps to eradicate intestinal worms in just 7 days. Discover now the 5 foolproof steps to eliminate worms from your intestines in just 1 week. Have you ever wondered how to get rid of these parasites quickly, effectively, and definitively? This is a complete guide that will reveal the secrets to a successful intestinal deworming. Did you know that intestinal worms still pose a significant threat to health in many parts of the world? Despite advances in medicine, these parasites continue to infect millions of people, causing a variety of unpleasant symptoms such as fatigue, weight loss, and abdominal discomfort. But today, we are going to turn the tables. In this video, I will teach you in depth the 5 fundamental pillars of combating intestinal worms: effective remedies, essential care, signs of improvement and worsening, foods that complement treatment, and powerful homemade recipes that complement today's protocol. We will unveil innovative and surprising strategies that go far beyond conventional treatment. We are about to uncover ancestral secrets, combined with the latest scientific discoveries, to offer you a comprehensive and holistic approach to the elimination of intestinal worms. Stay with us until the end and discover how you can achieve these results even today. This is the time to take control of your health and say goodbye to worms once and for all. And don't forget, at the end of this video, you'll receive a special tip that can further accelerate the parasite elimination process. So, don't leave without this bonus. And if you want to discover the real secret to truly effective natural deworming, click on the link below and download right away the exclusive content available in the video description. Imagine that your body is like a house, and parasites are unwanted guests who decide to stay without permission. These intruders can cause a range of problems, from stomach aches to fatigue and weight loss. How do parasites enter this house called the human body? They can come through contaminated food or water, insect bites, or even contact with infected people. To prevent these guests from entering, it is important to practice good hygiene, such as washing hands regularly and cooking food thoroughly. Avoiding the consumption of raw or undercooked meat and drinking clean water also helps keep these parasites away. But what if these parasites have already checked into our body? Symptoms may include stomach pain, fatigue, and weight loss. If you suspect an infestation, it's time to call a health detective, a doctor, to investigate. Doctors can prescribe specific medications to expel these intruders. Learn now about the main remedies to exterminate worms. 1. Nitazoxanide. Nitazoxanide is the first drug I'm going to present. It is a very effective and versatile medication used to treat various infections. It is especially indicated for treating viral gastroenteritis caused by rotavirus and norovirus, as well as various worm infections. These worms include nematodes, cestodes, and trematodes, such as Enterobius vermicularis, Ascaris lumbricoides, Strongyloides stercoralis, Ancylostoma duodenale, Necator americanus, Trichuris trichura, Tinea sp, and Hymenolipus nana. Nitazoxanide is also effective in the treatment of amoebiasis, which causes acute diarrhea or amoebic dysentery due to the Entamoeba histolytica/Dispar complex, as well as giardiasis, cryptosporidiosis, blastocystosis, balantidiasis, and isosporiasis. To achieve the best results when using nitazoxanide, it is important to follow some simple instructions. The medication should be taken with food to ensure good absorption. Before using the suspension for the first time, it is necessary to prepare it correctly. First, vigorously shake the closed bottle to loosen the powder. Then, add boiled or filtered water to the mark indicated on the label. Place the syringe adapter on the bottle, cap it, and shake again until a homogeneous suspension is obtained. If necessary, add more water to the indicated mark and shake again. To measure the correct dose, adjust the syringe to the hole in the inner cap of the bottle, turn it upside down, and pull the plunger to the volume prescribed by your doctor. The suspension can be administered directly from the syringe to the mouth or transferred to a spoon before administration. Any unused amount of the oral suspension should be discarded after 7 days. The mechanism of action of nitazoxanide is quite interesting. It acts against protozoa by blocking an enzyme essential for the parasite's survival. This mechanism also appears to be effective against worms. Regarding viruses, nitazoxanide acts by interfering with the viral structure, preventing the virus from replicating. The average time of action of the medication is 2 to 4 hours after administration. There are some situations in which nitazoxanide should not be used. Patients with liver or kidney diseases and those with an allergy to any component of the formula should avoid the medication. It is also not recommended for children under 1 year of age. Before using nitazoxanide, some hygienic measures are important to combat parasitic infections. Wash fruits and vegetables well, keep household utensils clean, cover food and water containers, keep hands clean and nails trimmed, use treated water, and avoid drinking water from unsuitable containers. Avoid walking barefoot in possibly infected areas and consume well-cooked meat from reliable sources. If you are breastfeeding or pregnant, consult your doctor before using nitazoxanide. The medication should only be used in these cases if the benefits outweigh the potential risks. Additionally, this medication contains sugar and should be used with caution by diabetics. Nitazoxanide usually does not have significant interactions with other medications, but it is important to inform your doctor about any other medication you are taking. Take nitazoxanide with food to increase its absorption. The most common side effects of nitazoxanide include abdominal pain, diarrhea, nausea, vomiting, and headache. Rarer reactions may include allergic reactions, increased liver enzyme levels, anemia, increased appetite, dizziness, fever, flatulence, hypertension, itching, rhinitis, tachycardia, and changes in urine or sperm color to a yellowish or greenish-yellow tone. These effects are not clinically significant, but if they persist, consult your doctor. Nitazoxanide should be stored at room temperature, between 15 degrees Celsius and 30 degrees Celsius. Keep it in its original packaging and discard any unused oral suspension after 7 days. Before using, observe the appearance of the medication. If there is any alteration, consult a pharmacist. If you forget to take a dose of nitazoxanide, take it as soon as you remember. If it is close to the time of your next dose, skip the missed dose and continue the treatment as usual. Do not take double doses to make up for the missed one. In case of overdose, seek medical advice immediately, bringing the medication packaging or leaflet. Nitazoxanide is available in powder for oral suspension, in packages containing bottles with 45 milliliters or 100 milliliters after reconstitution, and a dosing syringe. This medication is for oral and pediatric use for children over 1 year of age. If you have any questions or concerns during treatment with nitazoxanide, do not hesitate to consult your doctor. It is essential to follow medical advice to ensure the effectiveness and safety of the treatment. 2. Metronidazole. Metronidazole is the second drug on our list as it is a very effective remedy in treating infections caused by worms, such as giardiasis, amoebiasis, and trichomoniasis. Additionally, it is used to treat vaginitis and urethritis caused by Gardnerella vaginalis and other infections caused by bacteria that do not require oxygen to survive, such as Bacteroides fragilis, Fusobacterium sp, Clostridium sp, Eubacterium sp, and anaerobic cocci. This medication is suitable for both adults and children. The mechanism of action of metronidazole is quite interesting. It has anti-infective and antimicrobial properties, making it effective in eliminating disease-causing microorganisms. It is especially effective against anaerobic microorganisms, which are those that grow in environments with little or no oxygen presence, such as the intestine. Metronidazole works in these environments, destroying these microorganisms and preventing them from causing further health problems. Additionally, metronidazole has a strong antiparasitic action, meaning it eliminates worms and other parasites that may be in your body, ensuring you regain your health quickly. The dosage of metronidazole varies depending on the infection being treated. For treating trichomoniasis, the recommended dose is 2 grams as a single dose, or 250 milligrams twice daily for 10 days, or 400 milligrams twice daily for 7 days. Sexual partners should also be treated with 2 grams of metronidazole as a single dose. In the case of vaginitis and urethritis caused by Gardnerella vaginalis, the recommended dose is 2 grams as a single dose on the first and third day of treatment, or 400 to 500 milligrams twice daily for 7 days, and sexual partners should also be treated with 2 grams as a single dose. For giardiasis, the recommended dose is 250 milligrams 3 times daily for 5 days. For amoebiasis, the dose is 500 milligrams 4 times daily for 5 to 7 days. In the treatment of infections caused by anaerobic bacteria, The generally recommended dose is 400 milligrams 3 times daily for about 7 days, or as indicated by the doctor. Metronidazole tablets should be swallowed whole with a glass of water without breaking or chewing. Metronidazole is contraindicated for patients with allergy to metronidazole, to other imidazole derivatives, or to any of the components of the formula. It is essential to consult your doctor before using metronidazole if you are pregnant or breastfeeding, have central nervous system problems, liver failure, or if you are taking other medications, including over-the-counter medications. During treatment with metronidazole, it is important to be alert to possible side effects. If you experience skin discomfort, lack of coordination, dizziness, or seizures, you should seek medical attention immediately. Additionally, you should be cautious when driving vehicles or operating machinery, as metronidazole can cause confusion, dizziness, hallucinations, seizures, or changes in vision. Never discontinue treatment without medical advice and strictly follow the prescribed schedule and doses. In case of overdose, it is essential to go to the nearest hospital and take the medication packaging or leaflet with you. This will help healthcare professionals provide appropriate treatment. If you forget to take a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose and take only the next one. This helps to avoid accidental overdose and ensures that the treatment continues effectively. Each metronidazole tablet contains 250 milligrams of the active ingredient, as well as other components such as lactose monohydrate, starch, povidone, magnesium stearate, polyvinyl alcohol polyethylene glycol copolymer, and macrogol. Metronidazole is a powerful ally in the fight against infections caused by worms and other microorganisms. It acts effectively to eliminate invaders that threaten your health, ensuring that you can recover quickly. It is crucial to follow medical advice and take the medication as prescribed to ensure its effectiveness and safety. If you have any doubts or concerns during treatment, do not hesitate to consult your doctor. 3. Albendazole. Albendazole is the third drug on our list and is a widely used medication to treat various types of parasites that can live in the intestine or other tissues of the body. It is effective against worms such as roundworms, pinworms, hookworms, whipworms, threadworms, strongyloides, tapeworms, and Hymenolipus nana. Additionally, it is also used to treat infections such as opisthorchiasis and cutaneous larva migrans, as well as being useful in the treatment of giardiasis in children. It is important to know that albendazole should not be taken by pregnant women or those planning to become pregnant, as it can cause problems for the baby. It should also not be used by people who are allergic to any component of the medication's formula. If you are pregnant or suspect you may be, it is essential to consult a doctor before using this medication. Albendazole can be found in tablet or oral suspension, liquid, form. Tablets can be chewed or swallowed with water, and children may find it easier to chew them. The liquid should be shaken well before taking. Fasting or taking laxatives before using albendazole is not necessary. The dosage of albendazole depends on the infection and the person's age. For example, to treat roundworms and hookworms, adults and children over 2 years old need to take 400 milligrams as a single dose. For more complicated infections, such as those caused by tapeworms, the dose is 400 milligrams per day for 3 days. For children with giardiasis, the dose is 400 milligrams per day for 5 days. Older people, especially those with liver problems, should use albendazole with caution. For those with kidney problems, dose adjustment is generally not necessary, but careful monitoring is important. Like any medication, albendazole can cause side effects. The most common ones are stomach problems such as pain, nausea, vomiting, and diarrhea, as well as headache and dizziness. Allergic reactions, such as skin rashes and itching, are rare, as are increases in liver enzyme levels. Very rarely, severe skin reactions may occur. If you take more albendazole than recommended, you should seek medical advice immediately. Certain medications may interact with albendazole, either increasing or decreasing its effectiveness. Therefore, it is important to inform your doctor about all the medicines you are taking. Women of childbearing age should ensure they are not pregnant before starting treatment with albendazole, and it is advisable to begin use in the first week of the menstrual cycle or after a negative pregnancy test. In areas where there are many cases of tapeworm infection, albendazole may reveal a brain infection called neurocysticercosis, which can cause neurological symptoms such as seizures. There are no specific studies on the effect of albendazole on the ability to drive or operate machinery, but as it can cause dizziness, caution is advised. Albendazole has been shown to be highly effective in treating various parasitic infections, with high cure rates in many cases. It is a reliable choice for combating these infections and providing relief to patients. To effectively treat worms, it is not enough to just take the medications prescribed by the doctor. It is equally crucial to adopt rigorous hygiene practices to prevent the transmission of parasite eggs, which may not be completely eliminated by treatment. Here are some important practices that should be followed. First, wash your hands frequently. This is essential before cooking and after using the bathroom. Hands are one of the main vehicles for transmitting worms, so this simple measure can make a big difference. Avoid sharing towels with others, as this can facilitate the spread of parasites. Changing diapers for babies also requires extra care. Be sure to wash your hands thoroughly before and after each diaper change to prevent the spread of worm eggs. Additionally, it is important not to bite nails and not to put fingers in the mouth, as these habits can lead eggs directly into the digestive system. Keeping nails short is another practice that helps reduce the chance of contamination. Worm eggs can get trapped under the nails and be accidentally ingested. Washing bedding and towels at least once a week is also crucial. This removes eggs that may be present in the fabrics. Regularly cleaning bedrooms, bathrooms, and kitchens is also vital. Perform this cleaning at least once a week to ensure that worm eggs do not accumulate in these environments. If someone in the family has worms, these hygiene practices become even more important and should be maintained for at least 6 weeks. During this period, all family members should follow medical recommendations rigorously to ensure that the infestation is completely eradicated. In addition to these practices, there are also some home remedies that can help combat worms. Consulting a healthcare professional about these options may be helpful in complementing medical treatment. Following these hygiene guidelines not only helps treat the current infestation but also prevents future infections, ensuring a healthier environment for the entire family. When treating worms, it is important to be alert to signs that the treatment is working or if something is not going well. Let's first talk about signs of improvement. Signs of improvement appear when we follow the treatment correctly, according to the doctor's guidelines. One of the first signs is a reduction in abdominal pain and swelling. If you are experiencing itching around the anus or genital area, you will notice that this itching begins to decrease. It is also common to notice a reduction in nausea and vomiting. Another clear sign of improvement is no longer seeing worms on toilet paper or in stools. These signs indicate that the treatment is working and that the worms are being eliminated from the body. This brings great relief and improvement in quality of life. On the other hand, we need to be vigilant for signs of worsening, which indicate that the treatment may not be being done correctly or is incomplete. Some of these signs include unexplained weight loss and increased abdominal volume. You may also notice a lack of appetite and stools darker than usual. If you notice any of these signs of worsening, it is important to consult your doctor again. This may mean that the worms are not being eliminated and that the treatment needs to be adjusted. Do not ignore these signs, as they may indicate that the infestation is still present and requires medical attention. Maintaining open communication with your doctor and following all treatment guidelines are essential to ensure complete elimination of the worms and prevent new infestations. Being attentive to your body's signals is an effective way to monitor your progress and ensure your health. Parasites are small organisms that can live inside our bodies and cause various health problems. Let's talk about some of the most common types of parasites that can affect us: nematodes, tapeworms, and hookworms. Each of them has specific characteristics and causes different symptoms in the human body. Nematodes, also known as roundworms, are one of the most frequent types of parasites found in humans. They usually infect the intestines and can cause symptoms such as abdominal pain, diarrhea, and weight loss. Imagine these worms lodging in your digestive system, stealing nutrients, and causing discomfort. Tapeworms are another common type of parasite. They can be contracted by eating undercooked meat or consuming contaminated food and water. When a person is infected with tapeworms, they may experience nausea, vomiting, abdominal pain, and fatigue. Tapeworms can grow quite large inside the intestine, becoming a serious problem if not treated properly. Hookworms are parasites that usually enter the body through the skin, especially when walking barefoot on contaminated soil. These worms can cause anemia as they feed on blood in the intestines, leading to significant blood loss. This can make the person feel weak and tired, as well as cause abdominal pain. Parasite infections can vary in symptoms depending on the type of parasite. In general, signs include digestive problems such as diarrhea and abdominal pain, as well as fatigue, weight loss, and anemia. Nausea and vomiting are also common in parasite infections. If you suspect you may be infected with a parasite, it is essential to seek medical attention. Correct diagnosis and treatment are essential for your health and well-being. Do not ignore symptoms and seek professional help to ensure you receive appropriate treatment and fully recover. When it comes to combating parasites, your pantry can be a great ally. Some foods have natural superpowers that can complement medication treatment. Here are some of the heroes you can find. 1. Garlic. Garlic is known for its antibacterial and antiparasitic properties due to compounds like allicin. These compounds help combat a wide range of parasites, including intestinal worms, by helping to eliminate and prevent their proliferation in the digestive system. 2. Papaya. Papaya seeds contain an enzyme called papain, which is known for its antiparasitic properties. Papain can help paralyze and eliminate intestinal worms, making them less able to attach to the intestinal walls and facilitating their expulsion from the body. 3. Pineapple. Pineapple contains bromelain, an enzyme that aids in protein digestion. Additionally, bromelain has antiparasitic properties that can help combat intestinal worms. It works by breaking down proteins in the worm's walls, weakening their structure, and facilitating their elimination from the body. 4. Coconut. Coconut oil is rich in medium-chain fatty acids, such as lauric acid, which has antimicrobial and antiparasitic properties. These fatty acids can help kill and expel worms by disrupting their cell membranes and affecting their ability to survive in the digestive tract. 5. Carrot. Carrots are rich in dietary fibers, which not only promote digestive health, but also help expel worms from the intestinal tract. Fibers help cleanse the intestine by removing waste and unwanted worms, and promote regular bowel movements, thereby reducing the risk of parasitic infestations. Adding these foods to your diet strengthens your body's natural defenses against parasites and promotes better intestinal health. And to assist you in deworming, here are 4 simple meals that will enhance the action of the medications prescribed by your doctor. And the best part is that they can be made with ingredients you already have in your pantry. Recipe number 1. Papaya pineapple juice. Ingredients: 1/2 papaya, peeled and cubed. 1 slice of pineapple. 200 milliliters coconut water. Instructions: place all ingredients in a blender. Blend until smooth. Pour into a glass and serve immediately. Recipe number 2. Garlic and carrot salad. Ingredients: 2 cloves of garlic, finely chopped. 2 large carrots, grated. Juice of 1 lemon. 2 tablespoons extra virgin olive oil. Salt and pepper to taste. Instructions: in a large bowl, mix the chopped garlic, grated carrots, lemon juice, and olive oil. Season with salt and pepper to taste and mix well. Serve as a side dish or as a refreshing and healthy salad. Recipe number 3. Carrot coconut juice. Ingredients: 2 large carrots, chopped into pieces. 100 milliliters coconut water. 1 tablespoon shredded coconut. Instructions: place the carrots and coconut water in a blender. Blend until you get a homogeneous juice. Pour into a glass and sprinkle the shredded coconut on top. Serve immediately. Recipe number 4. Coconut detox juice. Ingredients: a 400 milliliters of coconut water. Juice of 1 lemon. A 1 apple. A 20 grams of shredded fresh coconut. 3 centimeters of peeled fresh ginger. A 2 kale leaves without stems. A handful of basil. Instructions: 1. Combine all ingredients in a blender and blend until the juice is smooth. 2. Drink without straining or sieving. It's a rich source of fiber, but can be strained if desired. Tip: instead of using ice, you can freeze some coconut water in ice cube trays and blend it with the other ingredients. Don't forget, in the description of this video, you will find a link to learn more about natural deworming. It's also important to note that, despite the guidance in this video, it does not replace a medical consultation. Intestinal life does not support self-medication. This video is for educational purposes and aims to provide useful information to complement intestinal healthcare. Thank you to everyone who watched until the end. Here at Intestinal Life Group, we are committed to providing quality content to promote better intestinal health. Don't forget to subscribe to our channel to receive weekly videos on health, wellness, and tips for a healthier life. If you have any questions or suggestions, please leave them in the comments below. We would love to hear your opinions and help wherever possible. Also, if you know someone who could benefit from this content, feel free to share this video to help more people.